Hello everyone, and welcome to this edition of Health Talk. I'm your host, Jill Fraley Dotson. Health Talk, a service of Pikeville Medical Center. Today, a very special guest with us talking about plastic and reconstructive surgeries. Very new to Pikeville Medical Center, Dr. Danikas joins us today, and we are going to cover a whole variety of different cosmetic and plastic procedures, reconstructive procedures that people in our area may be interested in. Dr. Danikas, thank you so much for being here. Welcome to Health Talk.
Thank you for inviting me.
Pleasure to have you here. You are very new to Pikeville Medical Center. Just December 1st was your first
Correct,
official day,
yes.
so just a couple of months. Pleasure again to have you here. First, tell us a little bit about yourself so our listeners and our audience can get to know you just a little bit better.
I trained in plastic surgery at Cornell and Columbia, New York. The hospital was the New York Presbyterian Hospital. Then I was in practice in a private group in New Jersey. Then I moved to Delaware, and from Delaware I came to Pikeville.
So, thoughts so far on the differences in the places you've been before and here to our region?
It's a very nice area. People are very friendly. That was a nice surprise to me. The medical center is very well organized, and I think there is a great opportunity here for a plastic surgeon.
Now, you are originally from Greece.
Yes, correct.
And a little different culture, no doubt, than what you're normally used to.
It's similar, very similar.
Okay. Well, we are going to talk about a lot of different things today, but first we want to mention the fact that you are a board-certified plastic surgeon by the American Board of Plastic Surgery. Talk a little bit about what it means to be board-certified.
That means that I passed the board exams, which are written and oral exams, and also I fulfilled other criteria that the board has, criteria of practice.
Okay. Now, are there certain certifications that you have to maintain to continue your certification?
The board certification has to be maintained every year, and there are certain activities that I have to participate so I can maintain my board status.
Pikeville Medical Center is obviously very special to all of us here. This is the service of Pikeville Medical Center, but I'd like to know why you chose this facility and this hospital as opposed to others throughout the country.
The hospital is very well organized. I was impressed by the clinic. It looks brand new to me, and people were very friendly.
Yeah.
Also, it seems that there is a need for a plastic surgeon in the area, and I can do really well.
We've had plastic surgery offerings for a while, but there may be some procedures that our audience may not have known about, and we're going to talk about some of those today. First, I would like to know what inspired you to become a plastic surgeon?
Plastic surgery is different than the other kinds of surgery because there is an aesthetic part to it. Plastic surgery needs also an artistic element, and this is very challenging, and at the same time I like to create and see beautiful things.
Yeah, and I know that it has to be so gratifying when you're able to help someone be the better version of themselves.
Yes, it's very, very rewarding.
Certainly so. One of the procedures that we're going to talk extensively about today is body contouring after massive amounts of weight loss. We hear a lot of people talking about having weight loss procedures done, be it by gastric sleeve or a bypass. And after those procedures happen and you do lose a lot of weight, there's a lot of excess skin left. So we're going to delve into body contouring a little bit more. So let's talk about the candidates, the right kind of candidate for body contouring.
The candidates are the ones that they have lost a lot of weight, and their weight is stable. They're not losing anymore. They have excess skin. This can be around the abdomen, on the back, the thighs, the legs, anywhere on the body. Then it's my turn to make them look better. So I have a variety of different procedures. I can do like lower body lift, upper body lift, thigh lift, arm lift. I can excise this excess skin and improve the contour of their bodies.
When you talk about a lower body lift, I'd like to kind of go into each one of those different procedures. The lower body lift, what does that entail?
That entails excision of excess skin and tissue around the waistline and pull the tissues up. So all these excess skin folds go away and the patient has a normal contour.
So if someone that has a lower body lift, would they be required or would it be beneficial for them to have an upper body lift too? You mentioned that earlier.
Upper body lift is different. Upper body lift is required for the patient to have excess skin folds on the upper back.
Okay. You also mentioned the arm area, and I know a lot of people who have had, who have experienced massive amounts of weight loss are very concerned about their arm region. Obviously, their abdomen is the most important to them typically, but their arms are something that they may have not known that they can be helped that way.
Yes, arms are important. Same thing with the thighs. Usually we start with the body lift because this is what will improve how the body looks, and then we can go into other areas. Arm lift involves excision of excess tissue from the inside of the arm, so the scar is not so visible. That can make the contour of the arms more normal and tighten up the skin, so the patient can wear a shirt and doesn't look bad. Same thing with the thigh lift, involves excision of excess skin from the inside of the thigh.
Now, are these procedures that can be done at the same time, or do they need to be spread out over a period of time?
They have to be spread over I need at least an interval of 2 to 3 months from one procedure to the other, so the patient can recover, and in this way he or she will tolerate the procedures much better.
That was going to be my next question about recovery time. Do the arms take less time than, say, the abdomen or the upper body lift?
Yes, the body lift takes more time. The recovery is related to the level of physical activity of each particular patient. Someone who does office work and works on a desk can go to work maybe after a couple of weeks. Someone who's doing manual labor has to take at least 4 weeks off from work.
At least 4 weeks.
Well, yes, it depends from the level of daily physical activity and how demanding is the work that each particular patient does.
What about the age of your patients? I know we see a lot of times younger individuals having the weight loss surgeries, and of course their bodies are no different than older people. Is there a limit to or is there a cutoff for the age that you think is too young to have these types of procedures after weight loss?
No, there is no too young or too old.
Okay, so anybody that has that potentially as a good candidate.
Yes.
Let's talk a little bit about the psychological effect that the weight loss surgeries and these procedures after the effect can happen, because we know that it is very difficult for people who have had weight loss surgeries. Their whole body changes, their whole mindset changes. I know that you counsel your patients too on the right time to have these type of procedures.
Yeah, before I operate in any of those patients, I need the psychological clearance. The patient must be medically and psychologically stable and have realistic expectations. Furthermore, those procedures improve the quality of life.
Yeah, and that's what's most important, isn't it? Because we see so many people who have struggled so much and then are able to have a different lifestyle change, and it's very hard, and you do want to improve their quality of life. Let's talk now about some reconstructive procedures involving the breast area. We hear a lot of times cancer patients now can have reconstructive surgeries to give them, again, a better quality of life after a procedure like that. Reconstruction of the breast for a cancer patient. Walk us through that procedure.
It can be done in a couple of different ways. Usually we prefer to do immediate reconstruction, so the patient will feel comfortable with herself right away. This usually gets done in 2 or 3 different stages. Another way is to do a delayed breast reconstruction for patients that had a mastectomy but the breast was never reconstructed. We can do also a delayed breast reconstruction. And the reconstruction may involve one side or both sides if the patient had a bilateral mastectomy.
Recovery time for those procedures?
Again, it has to do with the level of physical activity. It can be from 2 weeks up to 4 weeks. It depends on what exactly the patient is doing.
Cosmetic procedures, probably the most common is a breast reduction or a breast augmentation. Let's first talk about reductions and how young a patient can be. We see a lot of girls who may have a heavier top and that really are already having very early back pain.
Breast reduction is not really a cosmetic procedure, it's a reconstructive procedure. And breast reduction usually gets done because of the patient has back pain or neck pain, and this pain improves. It can be done in young patients, but a patient who is still growing may need a second operation in the future.
Okay. Augmentation, very popular surgery we hear a lot about. Do you see a lot of that in your practice?
Yes, there is a high demand for breast augmentation. It's one of the most popular procedures in the U.S. and in this area in particular.
Are there different types of surgeries? I know you hear some go through the arm or under the breast. Talk a little bit about the different.
There are different ways to access the area, and there are different ways that you can use to place the breast implant. The breast implant can be above the muscle, can be under the muscle, can be dual plane. There are also different kinds of incisions, and these have to be individualized according to what the patient needs and what the patient wants. My consultation for a breast augmentation usually is a long consultation. During the first consultation, I inform the patient about her options, and then she comes back for the second or a third time, and then she decides what exactly she wants.
What about, I know recovery time again is based upon the level of activity, but also what are the kinds of implants that you use?
We have saline implants, we have also silicone gel implants, which are safe and they're FDA approved. It's the patient's choice what she likes.
Is there one that you prefer over the other as far as what the finished product looks like?
No, it's the patient's preference. What I have, I give them the patient the implants, they can feel them in their hands, and then they choose whatever they like. Most of them, they choose silicone gel.
Silicone gel. Okay. We hear a lot about that in the news. Just wanted to clarify the two different types. Liposuction is another very common procedure that can be done on various parts of the body. So let's walk through those. Criteria to meet liposuction. We know that it's should not ever be considered a weight loss procedure.
Correct. Yes, correct.
So walk us through a little bit about the different types of liposuction you can have in the areas.
Any area with excess fat, pretty much we can do liposuction. Usual areas are the neck, the abdomen, the back, thighs, even the arms. We can do liposuction. As you said, this is not a weight loss surgery. It's just an area that the patient has localized fat that has to be removed. The incision for the liposuction are really small. It's like a 2 or 3 millimeter incision. There is a small scar which is hardly visible.
Is it hard to determine the best procedure for your patients when they come in and they may want the tummy area, the thighs, the arms? Would you do that at the same time, or would you have them determine which area is of most importance first?
Liposuction can be done in different areas. Of course, it has to do with the size of the patient and how much fat has to be removed.
Recovery time, I know that it takes a few weeks and it depends upon the level of activity, but are there compression garments that the patients need to wear?
Yes, the patient has to wear the pressure garments. Recovery time can be as low as 1 week, of course with the pressure garment, and it has to be individualized. Recovery has to do with the amount of fat that has to be removed and what kind of job the patient is doing.
Okay. Next procedure I want to discuss is tummy tucks. A lot of ladies and in our area are getting tummy tucks these days, but what is that procedure actually like? Because it's a little bit more invasive than some of the other procedures.
That involves excising the excess skin that is in front of the abdomen, especially the lower abdomen, but at the same time we make the muscles that are under the skin, we make them more tight, because usually babies stretch those muscles apart. Liposuction of the flanks, it's a nice procedure also that is complementary, and this has to be performed with a tummy tuck at the same time for a better result.
Takes a little bit longer to recover than, say, liposuction?
Yes. There is a long scar. Usually the scar is positioned under the area where the underwear or a swimming suit will go. Recovery can be again from 2 weeks to 4 months according to the level of physical activity.
And there are also drain tubes involved.
There are 2 drains that come out from the pubic area. Usually they stay from 4 days up to 7 days, sometimes a little bit more.
Most important thing though is to follow doctor's orders when you have any of these procedures done for the maximum benefit. Let's move to the face and to the brow and facelifts. And you were also telling me before we began our conversation today about a procedure that can be done on the ears.
Yes, it's called otoplasty. This is for the patients that have ears that stick out like this. Involves excision of skin and cartilage. Cartilage is that part of the ear that can be bent. and that brings the ears back to the head. Usually we do this to kids before they go to school when they're around 5 or 7 years old, but it can be done also in an adult.
Is that an outpatient procedure, or will it be required?
It is an outpatient
so it
procedure,
is.
yes.
And recovery time for that even in children?
Recovery time can be a couple of weeks.
Okay, so nothing too much to worry about, but certainly, again, helping the quality of life.
Yes, it has risks as everything else, but it's a nice procedure with a very nice, rewarding result.
Okay, let's talk about brow lifts, and who is a good candidate for a brow lift?
Anybody who has brows in a much lower position than usual. And this is more important for females than males, because somehow in males it is accepted from an aesthetic point of view to have brows in a low position. Females look much better with the brows elevated. Of course, a brow lift can be performed on a male if that's what he likes, or if that impairs his vision, because excess skin of the upper eyelid can restrict someone's visual field.
That's what I was going to ask next, because we also know that there are eyelid procedures that you can do, but would a brow lift in many cases fix that problem first rather than having the other procedure?
It can be done individually, but most of the times we do both procedures at the same time, the brow lift and the upper eyelid surgery, because that has a combined result.
Now, with some of those procedures, I know with the surgery there on the eyelid, when it obstructs your vision, some insurances will take care of some of that. Yes,
they will. There is a special test, there is a visual field test. If the patient fails that test, then that's an indication that the health plan should pay for this, should cover that.
Okay. What about facelifts? There are so many different types of facelifts, and people that watch television and all of these different plastic surgery shows, reality shows, you see that so much. This kind of facelift, that kind of facelift, different kinds of procedures. So let's talk a little bit about those. What is the most common type of facelift?
Well, the facelift itself is the most common procedure. Several plastic surgeons are trying to create a brand name or a trade name and market this procedure as something that they invented. Pretty much there is a mini facelift which has limited results. A mini facelift usually does not improve the appearance of the neck. If someone wants to improve the appearance of the neck, should go for the full facelift or at least a neck lift.
The incision for a full facelift, I imagine, is obviously different than the mini facelift. So what is the incision like for the full facelift?
It's an incision that starts in front of the ear and goes behind the ear inside the hairline. But that incision can be modified according to what the patient needs. The incision can be done also above the ear if someone wants to have a temporal lift, if someone wants to have a lift of the lateral area of the forehead.
Okay, so what the mini facelift, is that just in the lower region?
The mini facelift, usually the incision is in front of the ear, may go a little bit behind the ear, but that's a limited excision of skin for someone who has a neck that looks good and just wants to have the cheeks look more tight.
So for people who may not be ready for a facelift in their eyes, there are all different sorts of fillers and Botox that you can give to really improve appearance, even at a younger age, if they're not quite ready for those really more intense surgical procedures. Let's talk about Botox and fillers.
Yes, Botox and fillers, they do not exclude facelift. They can be complementary to a facelift. So a patient can have all of those procedures together for a better result. Botox and fillers, they improve the wrinkles and the skin folds on the face. Botox, the results of Botox last about 4 months, and then it can be done again. Most of the fillers last 6 months. Some fillers may last up to a year.
Are there only certain areas of the face that Botox can be used in, or can it be used all over the facial area?
Botox has been FDA approved for use between the brows and around the eyes. All other uses of Botox are off-label.
Okay. What about the fillers? Are there certain regions that those should just be used in?
There are different fillers, and everybody has been FDA approved for a different area. Most of them are for the nasolabial folds, the skin fold between the lid, and the cheek. There are also fillers that are FDA approved for the lips, for augmentation of the lips, and there are also fillers FDA approved for augmentation of the cheeks.
Okay. I know a lot of people always wonder if these procedures hurt or if there's a lot of pain involved. Thoughts?
There is not much pain involved with those. Botox gets injected with a very fine needle. Usually patients are not complaining about this. The fillers, many of them are coming with pain medication inside, but before I inject also my fillers, especially in the lips, I do a block. The feeling is the same when you visit your dentist and the lower part of the face is numb. I do exactly the same thing.
So really there should be nothing to be worried about as far as pain is concerned.
No,
with
it's not a really painful procedure now.
A little tiny bit of pain, but the benefit certainly outweighs that.
Usually patients are very happy with the result and they're not complaining about pain.
Okay. Rhinoplasty, something that we hear a lot about. Obviously, that is the nose procedure. What about people you hear all the time with deviated septums and things like that that require rhinoplasties? Walk us through that procedure.
Deviated septum is different than the rhinoplasty. Septoplasty means that the septum, the division that we have inside the nose, is not straight, and that may make breathing difficult. That's a septoplasty. Rhinoplasty involves more changing the contour of the nose when the nose has a nasal hump or is not straight or it has any other deformities. A septoplasty can be done with a rhinoplasty at the same time.
I'm sure that over the course of your years practicing plastic surgeries that you've seen a lot of different patients who may have some unrealistic expectations. I think we all want something to change with ourselves. We want to fix something. But when you have patients that really do, in your opinion, have unrealistic expectations, how do you deal with those patients?
I spent a lot of time with them. And as I said, during my first consultation, I make them aware of the options they have, and I make it very clear to them what is feasible and what is not feasible. And then I can have a second or even a third consultation with them until they know what I know and they're able to make a decision.
What about people who, along the lines of unrealistic expectations, we hear a lot about body dysmorphic disorder, which is very real. Thoughts on that?
These are patients that have unrealistic expectations, and no matter of how many plastic surgery procedures they have, they will never be happy.
We talked earlier briefly about insurances in the eye area that we spoke about, but when we went back to the beginning of our conversation talking about body contouring after weight loss, insurance sometimes will take care of some of those procedures, but let's talk about how it generally works with plastic surgery. And I do want to ask, does your office accept care credit?
Yes, we do take care credit.
Explain what care credit is.
It's like using a credit card to finance a plastic surgery procedure. The patient makes an application to care credit. The application usually gets approved, and the patient pays back care credit in the same way as you will pay a credit card.
So, and all of those applications can be filled out in your office?
Yes.
Okay. We have talked a lot about different types of procedures today, all over the body from head to toe, reconstruction, body contouring. A lot of advancements have been made, and I know you're excited to be here and bring some of those advancements during your stay here at Pikeville Medical Center. Talk a little bit about how the advancements have happened in the last 10 years.
A lot of things changed in the last 10 years. Breast implants changed. We have silicone gel implants. Even the silicone gel implants, we have new generations of silicone gel implants. Other equipment changed, even though we have new techniques for the same old procedures. Plastic surgery always keeps changing, and we always keep improving our results and our techniques.
I know you're very excited to see patients at Pikeville Medical Center. Like we said, you've only been here for a couple of months, and so we encourage everyone, if you're considering plastic surgery or would like to know more about a procedure, they can certainly call your office and make an appointment.
Yes, they can.
Certainly so. Now, Dr. Danikas' office is located on the 9th floor of the Pikeville Medical Center Clinic building. The phone number is 218-1000. You can call there to make an appointment and schedule your consultation for any of these procedures that we have talked about today. Thank you so much for being with us for Health Talk.
Thank you very much.
We invite you back anytime.
Thank you.
This has been Health Talk, a service of Pikeville Medical Center. I'm your host, Jill Fraley Dotson. Until next time, good day.